Hello everyone, my name is Shuri Welch and this is my Integrative Review presentation for NSC 890 through Eastern Kentucky University. So Healthy People 2030 identified the need for an increase in uptake of the human papillomavirus vaccine. The CDC recommends that children ages 9 through 14 receive 2 doses of this vaccine, and if they're of age 15 or older, they do require 3 doses of the vaccine. It is estimated that 35,000 people in the U.S. are affected by some sort of cancer caused by HPV. And on to the next slide. About 52.4% of teens in 2019 were fully vaccinated against HPV. This creates a problem because studies have shown that in order to achieve herd immunity status, at least 80% of a population must be vaccinated. The intervention identified. So as future nurse practitioners and primary care providers, we should increase the type of education we are providing to this patient population and their parents. And it's important that we assess the family and the type of education that would be appropriate for them. The PICOT question that was developed goes as follows. In adolescents and young adults, does increased education about HPV and the HPV vaccine compared to simple discussion methods increase the percentage of HPV vaccine uptake within 6 months of implementation? So while gathering scholarly materials for this review, several databases were of use, such as CINAHL, Cochrane Library, Up to Date, but all of the articles that I used were found through Nursing and Allied Health Premium. And below you can see the keywords that I used in order to find these articles. The theoretical framework surrounding this topic can be associated with Pender's health promotion model. So according to Pender, the health promotion model is used as a guide to process biopsychosocial processes that motivate individuals to engage in health behaviors directed toward the enhancement of health. So adolescents and young adults are in a period of transition where they're going from their parents and their primary caretakers being over their health care to having a sense of autonomy and having their own voice in what they want to do with their health care. The Level 1 systematic review that I used was titled Analysis of Community-Based Studies Related with Knowledge, Awareness, Attitude, and Behaviors Towards HPV and HPV Vaccine, published in Turkey in 2020. The article described the systematic review process of 23 articles that were found eligible for their review, and they were all published between 2009 and 2019. All of the articles chosen focused on the person's attitude, knowledge, and behaviors associated with HPV vaccine. They did find there was a direct correlation between one's level of education and their level of knowledge when asked about the HPV vaccine. Barriers that they found would keep people from partaking in the HPV vaccine was safety and efficacy concerns, price of the vaccine, people believing they were not at risk, and a lack of consistency in the education that they were receiving. The Level 2 randomized controlled trial, this consisted of pre-tests and post-tests. And in between those tests, there were 4 groups, and they were all offered some type of education about HPV and the HPV vaccine. The control group received only a brief written piece of information on those topics, while the other groups had extra education, and it did show that those with extra education did have more knowledge in the post-test, and it did increase their willingness to vaccinate. The qualitative study used, it was done in Southwest England. The article is titled, "How Acceptable is Adolescent Self-Consent for the HPV Vaccination? Findings from a Qualitative Study in Southwest England." And this was published in 2020. So the study focused on trying to figure out and analyze if parental consent was a barrier in adolescents' uptake of the HPV vaccination series. In England, it is legal for adolescents of ages 16 years and up to consent for their own vaccinations if they are deemed competent using the Gillick competency screening. In the next slide, when I was trying to find a good picture of the Gillick competency screening, I found this table, and I felt like it really summarized the complexity of giving an adolescent the right to give consent versus their parent being over it. I just thought it was a really good table to look at. So, summary of the findings. All studies did prove that an increase in education did increase one's knowledge, acceptance, and willingness to vaccinate. Application to practice. So, as future family nurse practitioners, we must assess a patient and their family's ability to be receptive to education, to be able to provide an appropriate type of education, one that fits their needs. It's important to initiate the conversations about HPV vaccination early. Again, it can be administered as early as 9 years of age. We must build a good rapport with the parents and the patients. And on to ending statements. We need to offer vaccines whenever there's an opportunity. And the end goal would be for an increase in uptake of HPV vaccination would decrease the amount of HPV-related cancers. And again, in summary, the articles and the review did prove that an increase in education about the HPV vaccination and HPV did increase uptake and knowledge of the HPV vaccination series. Thank you for listening.